Hello, I'm Charlene Stevens, the City Administrator for the City of Cottage Grove. Joining me today for Council Update is Councilmember Dave Thiede. Today we're discussing temporary health care dwellings. Councilmember, this is something that came out of the 2016 state legislature, which was a requirement for cities to allow temporary health care dwellings for to allow people to care for the purpose of caring for mentally or physically impaired relatives or their caregivers on a temporary basis. And the law also defined family members, but the law was a requirement to provide them, or cities were allowed to opt out of the provision. And the Cottage Grove City Council on the August 10th made the decision to opt out. And maybe you can discuss some of the reasons for that and the rationale behind that, and went through the Planning Commission as well as the City Council.
Right. And I believe Minnesota put this in place, for certain specific situations and locations, and actually there's a lot of cities, especially urban, suburban, that don't have a lot of big yards and things like that, or that really have opted out of this because it just really doesn't totally fit, and it can become somewhat cumbersome and burdensome, and on-site parking and all that sort of stuff, and all the things that go along with it. So, in most of our houses, especially in Cottage Grove, and that they typically have enough space. So if there's a family member or something like that needs a little extra care or whatever it might be, that there's enough room in the existing structure, so you don't have to kind of bring in this little pod of a room or whatever.
And some of those concerns would be how it might be perceived by other neighbors who are viewing that from their front, as well as the temporary utility connections, and even how the city would manage temporary utility connections to that unit and such, and the potential burden maybe on public safety as well for those facilities. So the City Council made the decision to opt out, which was allowable. We had the public hearings, and we really didn't have anybody who came and expressed any concern to the City Council.
No, because I think it was pretty well expected, and that's why a lot of the municipalities and that are opting out, because it was expected that would be the case.
All right. For more information about the temporary health care dwelling ordinance, contact Community Development Director Jennifer Levitt. Thank you, Councilmember Thiede.
You're welcome.